You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Do you have asthma, emphysema, sleep apnea, or lung cancer? If you do, or if you have any questions regarding these topics, you have to hear what my first guest has to say. He is a pulmonologist who is getting a lot of attention lately because of the results he's getting with his patients. If you have any of these conditions, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Jim Vevina. He is a board-certified pulmonologist, former president of the San Diego Pulmonary Society, fellow of the American College of Physicians, and fellow of the American College of Chest Physicians. He is in private practice in San Diego, affiliated with Sharp Memorial Hospital. We've invited him on the program today to discuss the latest diagnosis and treatment of lung diseases. Dr. Vevina, welcome to the program.
Thank you, Randy. It's a pleasure to be here, and I hope we can add something to your viewers.
Sure. Now, before we get into today's topic, I guess it's a big topic here,
Sure.
Lung diseases. Tell us about your practice.
Well, I'm usually the doctor of last resort. After people have seen a number of doctors, they usually come to see me. I'm at the end of the line.
Is that right?
That's the way it usually goes. Most of the people will come and see me for one of three things. They'll have a cough, they'll be short of breath, or they'll have chest pain. And they'll have one of four diagnoses. They'll have either asthma, they'll have emphysema, they'll have lung cancer, or they'll have a sleep disorder, like sleep apnea. That's what they'll come to see me for.
Let's begin with asthma. What defines asthma?
Okay, Randy. Asthma is a disease of the lungs, and I brought a chart from my office to show your viewers exactly what happens in asthma. Basically, we have the big tube here called the trachea, which is your windpipe here, and this breaks up into the right and left sides of the lungs, and there are all these little tubes that go into the lungs, and in asthma, these tubes become really, really tight to the point where you can die and choke to death. So
with inflammation?
With inflammation.
So they become swollen in a way?
They become swollen. This is a disease of inflammation. And
so asthma is a disease of inflammation?
Absolutely.
So the lungs are inflamed?
They are inflamed.
Okay.
And so we have typical stories of people who come to us with asthma. There are many different kinds of asthma. And let me just show you or paint you one scenario which is typical.
Okay.
Let me call this kid Johnny Come Lately. He's the new kid in town. And he comes home from school. He might be in middle school or he might be in high school. He comes home and he tells his mom, I'm really mad at the gym instructor. He made me run a mile and I was really tired. Right there's the diagnosis.
So what are the different classes or categories of asthma?
Okay, there's the exercise-induced asthma. We talked about Johnny.
Okay.
Then there's the intrinsic asthma, which is the most severe. You know, you can die from this kind of asthma. And I had a doctor friend of mine who actually died from it.
Wow. Then
there's the chemical asthma, and we'll go through all
like
these.
some type of reaction from the environment.
Right.
That's an allergic reaction of some sort.
Allergic reaction to chemicals or environmental stuff. And then there's another thing called Samter syndrome. Samter was a doctor in New York City, New York, who discovered this triad. What the three things are is you get inflammation in the sinuses, you get asthma in the lungs, and you're allergic to aspirin. So you put these three together, and the patient tells you the diagnosis. He says, every time I have an aspirin, I go into a severe asthma attack. That's Samter syndrome. So the treatment again there would be mostly avoiding aspirin and other things that the patient might be allergic to, plus finding out what drugs work best for that particular patient. So there are all these different kinds of
Now there are new drugs.
asthma.
You say that you have access to some drugs that nobody else is using.
Right. Most doctors are not using, but there are about 5,000 patients now in this research study that I'm working on. This drug has been approved by the FDA, the Food and Drug Administration. It's a drug called Xolair, Xolair. And what this drug does is it breaks up a protein in the blood called IgE. So this IgE, when you're allergic to something, let's say a cat.
Okay. A cat.
The cat puts out dander, and this dander gets into your blood, and eventually it gets into your lung, and it attaches to this molecule, IgE molecule. And this drug, it's like a buster. It busts up this whole molecule. So I've used it very successfully in a lot of patients.
What is it called?
Xolair.
Xolair.
Right.
Now, I spoke to a few physicians with children that are asthmatics, and I said, have you heard of this drug? And these are, mainstream physicians. They said they haven't heard of it.
Well, you could be mainstream, but if this is not what you do for a living, this is what I do night and day.
We're going to take a quick break. When we come back, we're going to move on to emphysema and lung cancer and sleep apnea. But what do you say to the person watching this? They themselves, a loved one, a child, has asthma, and maybe they're not getting the results that they want. What do you say to them?
I say, come on in and see me. We will leave no stone unturned to find out what's causing your asthma, how to treat it, and you might have to make changes even in your personality and the way you react to things. I might tell you, some people just perfume.
Okay.
They overreact to perfume.
And those things are missed.
And those things are missed. Absolutely.
Now, you told me something before we started. You said that, you were bragging a little bit. You said that you probably have one of the most comprehensive programs for asthma treatment and a lot of the other pulmonary diseases around.
Right.